Hi, Misty. My name is Allison. How are you doing today?
I'm doing good. How are you?
Good. I would like to welcome you. I'm so glad you're here today. Um, is there anything that you need or I can get you? Maybe a glass of water or to know where the bathroom is?
No, thank you.
Okay, great. Just let me know if at any point during our time together that you need anything because I want you to be comfortable while you're here with me.
All right.
Okay. Um, did you find our office okay?
I did.
Okay, good. So I'm a nurse practitioner. Are you familiar with nurse practitioners?
I am.
Okay, great. So I'm a nurse practitioner of psychiatry, and I'll just be following your care while you're seeing us in this office. Okay.
All right.
All right. So I'm just going to be asking you a lot of questions today. Some may have to do with why you're here, and some might seem like it doesn't have anything to do with why you're here today. But just knowing all the answers to these questions will help me provide you with the best care that I can.
All right.
Okay. So, what brings you in today?
So lately, I've had increased anxiety and I've had difficulty falling asleep and staying asleep. I usually go to bed around 10 and then I wake up around 3 a.m.
Okay.
Um, but I'm anxious because my boards are coming up and I just I'm a big procrastinator.
Okay. So you're just feeling a little more anxious due to the boards that you're about to take, and you're also having some problems sleeping.
Yeah,
Okay. Um, how long have you been feeling this way?
probably 2 months.
Okay. And what boards are you studying for?
I'm a pharmacy student.
Oh, okay. Great. Um, so during the time that you've been having these feelings, have you had any thoughts of harming yourself or maybe even ending your life because of this feeling of worry?
No, no thoughts of hurting myself. Just worrying that I might fail the boards.
Okay. Um, So, if at any time during while you're feeling this way, it's important that you definitely let me know if you start to have any thoughts of harming yourself or even ending your life, and that way we can talk through them together and kind of get to the bottom of them and make sure that you're safe.
All right, thank you.
You're welcome. Have you ever been a patient in a psychiatric hospital?
No, I have not.
Okay, never been a patient in a psychiatric hospital. Um, have you ever felt this way before, this anxiety, or talked to a counselor about it before?
So during undergrad at UGA, there was a time where I had some increased anxiety, and I did see a Dr. Shapiro at the health center.
Okay. All right. So you did see a doctor before at the health center about your anxiety.
Hmm.
Okay. All right. Did you take any medication when you saw the doctor at the health center?
So he actually started me on Prozac, but I didn't continue the medication.
Okay.
There were too many side effects.
Okay.
But I did take Zoloft for about a year.
Okay. And that seemed to help.
It did help.
Okay. Um, so just kind of spinning off of those medications, I'm just going to ask you about a couple more. How long did you take the Prozac for before you stopped it?
Maybe 2 weeks.
Okay. And let's see, 2 weeks. And what were your side effects that made you stop taking it?
They were mostly GI side effects, mainly nausea.
Okay. All right. So Prozac gave you some nausea, and you couldn't tell if it worked or not.
No, if anything, I felt like my anxiety was worse.
Worse, okay. And then the Zoloft, do you remember, you said you were on it for a year. Did you have any side effects with that?
No side effects. And he started me on 50 milligrams and
Okay,
he worked me up to 100.
okay. And, that seemed to work well for you?
It did.
Okay. Have you ever taken Paxil before?
No, ma'am.
Okay. What about Effexor?
No, ma'am.
Okay, and Cymbalta?
No,
Okay, so just Prozac and Zoloft are the only ones that you've taken.
that's it.
Okay. Have you ever experienced a traumatic event or been in a situation where you felt maybe threatened and still think about it every once in a while?
Um, well, when I was in college, I went on a road trip with friends, and we happened to be driving on our bridge that was on a sharp curve, and we almost wrecked. So nobody was hurt, but I think about that quite a bit.
Okay. So you almost got in a wreck with some friends in the car, and that kind of causes you some stress every once in a while.
Yeah.
Okay. How long ago did this happen?
Probably 10 years ago.
Okay. All right. So what ultimately happened with that experience?
Nobody was badly hurt.
Okay.
Everybody was fine. It was very traumatic.
Okay. So everyone ended up being okay, but you still think about it every once in a while.
Yes.
Okay. So now I'd just like to move on to your medical history, and we're just going to talk about any illnesses that you might have had in the past or currently.
Okay.
All right. Have you ever been hospitalized for any reason?
I've had no hospitalizations, but I've had a tonsillectomy and surgery on my right foot.
Okay. So just surgery on your foot and you've had your tonsils out. What about any high blood pressure, diabetes, anything like that?
Just chronic migraines.
Okay. So you get migraines. Are they brought on by anything specific?
Probably stress.
Okay. All right. Um, do you take medication for those?
I do. I take 20 milligrams of propranolol.
Okay. So right now you're just on propranolol, but that's all that you're taking, no other medications.
That's it.
Okay. Great. When was the last time you saw your doctor, your primary care doctor?
6 months ago.
Okay. And every you checked out, everything was okay. There are no new diagnosis.
Yes, ma'am.
Okay, good. Um, so you don't have any chronic diseases except for those migraines that you get that are mostly brought on by stress, but you take the propranolol for that.
Right.
Okay, perfect. Um, have you ever had a head injury, fainted, lost consciousness, or had any kind of seizures or anything like that?
No, ma'am.
No? Okay, great. Um, Now we're gonna just talk about drugs and alcohol for a little bit. I just want you to know that it is important that you're as open and honest as possible. I know this can be a hard topic to talk about sometimes, but it can affect how we feel sometimes. Okay?
All right.
All right. So a typical weeknight, what does that look like for you? How many do you drink alcohol on the weeknights?
I drink probably, well, I have 1 to 2 glasses of wine every night.
Okay. All right. And what about the weekends?
Um, I probably share a bottle of wine with my husband.
Okay. All right. So on the weeknights, you probably have about, on the high end, 2 drinks per night, and the weekends about 2 or 3 drinks per weekend night.
Yeah, that
Okay.
sounds right.
Okay. So let's see. That's about like 14 drinks per week, you would say?
Yeah.
Okay. All right. So, you may not be familiar with the recommendations for women and when it comes to alcohol, but it's usually recommended that about 6 to 8 drinks per week we consume, and that's really because we metabolize alcohol a little bit differently than men do, um, and it has some health risk drinking excess of the 6 to 8 drinks per week, including like hypertension, some cancers. So let's talk about some ways that you might be able um, to reduce your intake of the alcohol. Um, how would you feel about maybe substituting um, the wine that you're drinking during the week for maybe either some sparkling water or some juice mixed with sparkling water?
I can do that.
Okay, and then maybe you could have a couple glasses of wine on the weekend with your husband.
Yeah,
Would that work?
I'm open to that.
Okay, great. Um, do you take any painkillers?
No,
Okay, so you don't take any painkillers. Are you familiar with the epidemic that has come across the United States recently with opioids?
I am.
Okay, so that's great. If you're feeling any kind of pain, then we recommend that you would take like an extra strength Tylenol or Aleve um, instead of any major painkillers. Um, what about caffeine? Do you drink a lot of caffeine?
Yes, I love coffee. I drink probably 6 to 8 cups a day.
Okay, so that could be contributing to some of your trouble sleeping. Um, when is the latest time in the day that you drink a cup of coffee?
Probably around 4 p.m.
Okay, so would you be willing to look at cutting back your caffeine intake?
Yes, definitely, if it will help with my sleep.
Okay, so how about could you maybe try? We could start cutting it in half, and maybe you could drink 3 to 4 cups of coffee a day, and that way you could maybe be have a little bit easier time sleeping at night, and maybe we could have you drink your last cup by lunchtime around noon.
Yeah,
Does that work?
I can do that.
Okay, so we can give that a try. Um, and then sometimes you could also just take a walk in the evenings, 10 to 15 minutes. Do you have animals? Do you have dogs?
I do. I have 2 dogs, a German Shepherd and a Golden Retriever.
Okay, so you could maybe take them for a walk in the evening, and that'll maybe help you settle down a little bit and help you sleep a little bit better as well. Um, so now I'm just gonna switch gears and talk about your childhood a little bit. And some of these questions you may or may not know the answers to, and that's okay. We're just gonna kind of see what you do know. So first, I'd just like to talk about your life. So, do you know anything about the time when your mom was pregnant with you?
I think her pregnancy was a little bit stressful, as she was going to be a single mother. There were some financial restraints, um, and certain stressors that she had to deal with.
Okay. Did she say anything to you like that, or did you just get the sense that it was a little bit stressful time?
No, I just kind of picked up on that.
Okay. All right. Were you delivered normally?
It was actually a
A
C-section.
C-section? Was it an emergency C-section, or were there any further complications that you know of?
No other complications that I know of.
Okay, great. So no complications. Um, how many siblings do you have?
I'm the only child.
Okay, so you're an only child, so your mom did not have any other children except for you.
Correct.
Okay. Let's see. What do you know about your dad?
Biological father is unknown.
Okay, so you don't know much about him. All right. What was your mom like?
So as a single mom, she worked multiple jobs to support the two of us. She was very loving. She worked nights, but during the day, she spent as much time as she could. Um, I'd say she was strict, um, but not so much in the sense, she did keep a close tabs on my grades.
Okay. All right. So she was a little strict, but you still feel like she um, was loving and took care of you and made everything she could to make ends meet.
Yeah.
Okay. Were there any other family members around?
Yeah, I'd stay with my grandmother on the weekends.
Okay. Great. So you were pretty close with your grandparents.
I was.
Okay. Um, what school did you go to?
I went to Appling County High School.
Okay. Um, so would you consider that a good experience? Did you like it?
Yeah, I'd say it was a good experience.
Okay. Um, would you consider yourself a good student?
I was a good student. I graduated early um, because I finished all of my AP credits ahead of time, and I took honors. So,
Oh, wow. I would definitely say that's a good student.
mhm.
What about your teenage years? Was there anything unusual during that period of your life?
During my freshman and sophomore year, I did go through a rebellious stage. I'd sneak out of the house, but I did eventually get caught. Um, so I would my mom would insist that I'd stay at my grandparents if she was working the night shift.
Okay. All right. So you just had a little rebellious period, but kind of turned around once you started staying with your grandparents.
Yeah,
Okay. And you said you completed high school. You graduated early.
I did.
Did you go to college?
I did. I graduated from the University of Georgia with a degree in chemistry, and then I went on to pharmacy school, which I graduate in May.
Okay. That's great. Congratulations.
Thank you.
Do you currently work?
Yeah, right now I work part time at Publix as an intern. But other than that, I'm a full time student.
Okay. How many hours would you say you work a week?
At Publix, I'd say probably around 20.
Okay. That's a decent amount of work on top of school. So I could see that sometimes that's can be a lot of on your plate. Um, what about your husband? Can you tell me a little bit about him?
So he's a pharmacist too.
Okay.
Yeah, we met in high school. We're high school sweethearts, but he's working while I'm finishing school, but he's very supportive and loving.
Okay. All right. So you have a good support system through him at home while you're working on your studies.
I do.
Okay, great. And is he pretty healthy?
Yeah, he's healthy.
Okay. All right. Um, do you attend church regularly?
I do. Yeah.
Okay. Great. So you does your husband go with you?
So he has to work every third Sunday, so I usually stay home on that weekend, but
Okay.
um, the other weekends of the month we go.
Okay, great. And you feel like you have a good community there and through other friends locally?
Yeah, we do. Well, with COVID, we've been watching, the sermons online,
Okay,
um, but I hopefully we can get back to normalcy soon.
good. So even through COVID, you've been keeping that area of your life, that community there and strong.
We've been trying. It's hard.
Okay, good. Is there anything else you'd like to tell me about this part of your life?
No, I think we've covered it all.
Okay, great. So now we're just going to move on. I'm just going to talk to you about some different symptoms of some psychiatric illnesses, and you can just answer yes or no whether you've experienced them before. Okay.
Okay.
All right. Do you consider yourself an excessive worrier?
Yes.
Okay. All right. Have you ever heard voices, but they're not actually there?
No.
Okay. Um, Have you ever felt like you've seen someone in your house, that maybe they talked to you, but then you realized they weren't actually there?
No,
Okay. Have you ever thought the person on TV was put there, to deliver messages directly to you?
no,
All right. Do you ever feel like people are conspiring against you, maybe at work or in social situations?
no,
Okay. Um, has there ever been a period of time where maybe you couldn't sleep for a few days, but you still had a lot of energy, um, and so you didn't feel tired even though you hadn't slept for a while, and did some impulsive things, like maybe went on a shopping spree or took an impulsive trip?
no.
Okay. All right. Well, these are all the questions I have for you today. Um, I think it sounds like you are having a little bit of anxiety due to some stresses that are going on in your life right now, as far as finishing up school and taking boards very soon. And I think that that increased caffeine intake isn't helping you with your sleeping and your anxiety. So, like we discussed, if you could just, we'll start by cutting back your caffeine intake. Um, and we'll also have you cut back on your alcohol intake, like we talked about. So during the week, just trying to stick to that seltzer water, and then on the weekends, having some wine with your husband. Um, cutting back to that 3 to 4 glasses of caffeine a day. And then I am going to start you on some Zoloft, which is an antidepressant. We're going to start at 25 milligrams. And then after, well, I'll see you back in 10 days. And then we'll go through your family genogram, and we'll take a look and see if you're sleeping a little bit better and feeling a little bit better, and we can maybe look at some sleeping medication at that point as well. Do you have any questions?
I don't. Thank you so much.
You're welcome. I just want to thank you for coming in today. And we'll see you back in 10 days, and we'll look at your family genogram.
All right. Thank you.
All right.